Now, DocPod's 3 myths in 3 minutes.
3 myths in 3 minutes. Here we go. Myth number 1, see if you can help us out. If you have PCOS, you can't get pregnant.
Not true. So, yes, there are women, believe it or not, with PCOS who have normal periods every month. And that means you're ovulating every month and you can get pregnant. There are also women who do have infertility because they never ovulate and never get periods. But you can have anywhere between those extremes, and you could just be occasionally ovulating and have occasional periods. And so that is a person I would consider as subfertile, but you're not infertile. So you still need birth control if you have PCOS.
Important to know. All right. Myth number 2, only overweight women get PCOS.
Not true. I have diagnosed PCOS in women with totally normal body mass indexes or normal weight, and absolutely don't struggle with their weight. And it is a hormonal disorder, often linked with weight, but not always. And I've done testing on women who just come in with a complaint of, say, increased hair growth or increased acne, and I'll check a testosterone level or something and realize, like, wow, they've probably got PCOS.
Yeah. And this is why we need to get the right knowledge, right? So myth number 3, and this is why we're doing this segment, because again, we all see information that's out there, but we want to make sure we're getting the right information from board certified, trusted, vetted doctors like Dr. Kirti Patel. So again, myth number 3, doulas are just for natural or home births. They actually replace doctors.
So no. In both of those cases. So no, doulas can work with you in any setting, in the hospital or at home, and also for C-sections, because the doula is really just an individual who provides emotional, physical support for you throughout the process. And they're advocating for you, they're educating you, and that can be done however you have, however you experience pregnancy or childbirth. And then they definitely don't replace a clinical person like a doctor or midwife, because they aren't doing deliveries or C-sections, for example.
Yeah. Super important for people to know. And again, some people might be like, of course they don't, but that's why we have to talk about these things, right? We have to make sure that we're all getting the right information. And one thing I really like about the Gynarchy is there's a lot of good topics, high demand topics that you're talking about: fertility fears, body image stigma, empowering birth support, all of this. It really showcases for me your expertise in kind of this reproductive justice, healthcare equity, and patient empowerment. So well done.
Thank you so much.